my name is Dr. Harsh Mahajan. I'm the founder and chairman of Mahajan Imaging and Labs. We run a chain of integrated diagnostic centers in the Delhi NCR area and predominantly into imaging, radiology, nuclear medicine, and lab medicine pathology. For me, patient healthcare, centric healthcare is when the focus is completely on the patient, on the disease, but on the person as well as a whole. And we should also be seeing the circumstances under which the patient has come, and it may vary from one to the other. Also, I think the most important thing in healthcare, especially for a doctor and a patient, is that doctor-patient relationship, which actually can be built, that trust can be built through conversation, from hearing what the patient really wants to say. And that's where maybe in this humdrum of life and the speed at which modern life is moving, one loses sight of that. So interacting with the patient, hearing the problem that they have, and looking at the person holistically rather than just looking at the disease that they have is, for me, patient-centric healthcare. See, AI has been there for about 10 years now, starting with deep learning. 3 years ago, we got generative AI, and about a year and a half ago, agentic AI. So it has moved by leaps and bounds. Its capabilities are immense. And I feel, especially in the diagnostic sector, and more so in radiology and imaging, I'm a radiologist. My field, AI has a lot of potential because we've been digital right from day one. And that's where tools can be built, both for helping the radiologist make a report, a diagnosis, as well as for technologists to improve the quality of imaging, improve the way we measure disease, the tumors, the volumes, all of that is low-hanging fruit as far as artificial intelligence goes. Then for clinical judgment, for making the decision as to what is the correct treatment, all this, I believe, with a human in the loop. There should be a doctor who is using artificial intelligence as a tool, as an assistant, rather than be mastered by it. Here, I think already we are seeing in radiology, in cardiology, in neurology, dermatology, ophthalmology, these are fields where AI is already making an impact, and very soon in histopathology also. And to break the silos, currently what we have is so much data that is there, so many tests. How to make sense of all of that? I think AI will do a great job in breaking these silos. The problem in adoption, of course, especially in our country, is that we are a fragmented healthcare system. We don't have digital infrastructure in many hospitals. Also, there is a cost that is associated with going digital as well as with adoption of artificial intelligence. And finally, the trust in artificial intelligence tools has also to be created, and that can only be created if we actually utilize the technology. Having said that, I do see that in the next 3 to 5 years, it will become inevitable to become digital and slowly adopt those tools of artificial intelligence where you are able to build trust. So I think, as someone has said, we will need to change before we have to. So artificial intelligence use in healthcare, I believe, if used ethically, if used properly, if used making use of the best tools that are available and with a human supervision, I see only an upside. It will improve our accuracy, it will improve turnaround time of reports, it will also, in the long run, make healthcare delivery cheaper. I think Financial Express has been one of the go-to publications along with the Indian Express. And this, you know, conference that has been held, curated very well by Financial Express, has brought together some of the leaders of the field of healthcare, not only healthcare delivery, but also healthcare medtech, home health providers, telehealth providers, all brought together under one roof along with genomics, which I think this bringing together of diverse fields of the healthcare ecosystem will go a long way in improving the overall ecosystem of healthcare. And I must say that Financial Express has done great research and has talked about subjects which are really going to lead to transformation of healthcare delivery in this country. These subjects have been debated, have been spoken about at length, and there are takeaways which any healthcare delivery provider can take away from this conclave and can actually lead to transformation of how they treat patients in their healthcare ecosystems.